Thank you very much. Mr. President, we are very grateful as the health family to host the President in the province of the Western Cape. The plan that has been led by yourself as a President and the Chair of the National Coronavirus Command Council was to actually see the extent to which we are able to use the space which we obtained through the lockdown to increase the numbers of beds and improve the response from the health sector. I think we've been able to demonstrate more beds being created, more public-private partnership, more staffing that's been brought onto the plan, as well as also to appreciate the challenges that have been taken through. I want to say thank you to the Premier as well as the Provincial Health Department. We've worked together and all the health workers. We're very grateful. So your presence here today really has created a lot of a momentum and created a lot of encouragement to our team. So I want to just say thank you very much to you. Thank you.
Thank you very much, Mr. President, the Premier of the province, my colleague Mhkize, and Nizam, the man from Santaco. He likes to compare the taxi with aeroplane. And when we fitted HEPA within the aeroplanes and we gave them the right to fly with 100 people inside. And then the taxi people ask, why is Mbalula not fitting HEPA inside the taxi? So I said, we can't fit in high efficiency particulate air filter inside the taxi. Don't compare bananas with apples. So, but thank you very much, President and the Western Cape government for this innovation. We know that as we continue to fight this virus going forward, there's innovation like the Premier said, and that this will add up to some of the new ideas to alleviate the situation of essential workers. Thank you, and thank you very much. Thank you.
Your Excellency, Mr. President.
Well, thank you. This has been a day well spent here in the Western Cape, interacting with the Premier and his MECs and key officials, as well as with ministers from national departments. We've had an opportunity of getting to know at first hand the initiatives that they are involved in, particularly with regard to continuing to flatten the curve. Now, our coming here was out of great concern because the rate of infections in the Western Cape have way outrun the infections elsewhere in the country. The Western Cape represents about 66% of infections in the whole country and some 77% of the deaths. Now, that has to be brought down. And that is why we even declared a number of places in the Western Cape as hotspots. Now, I'm very pleased that with the plans that are on the table now, and the plans that will also be enhanced with some of the suggestions, the thoughts that were put on the table so that they can inject more energy into all the initiatives that are underway, we should be able to bring down the rate of infection and also give more attention to the hotspots. Already we are seeing good signs of being able to do so. In Witzenberg, which we've declared as a hotspot, we can already see that with all the tools in our toolbox that we are deploying in an area like that, we're beginning to see some progress. And I'm sure that we will also see progress in other areas. The installation of the field hospitals, the establishment thereof, also is going to stand us in good stead. We are going to pull out all stops to make sure that we have more beds than what we have now, and also more beds than what they had planned. And I've said I want to see more beds being installed here so that we are ahead of the curve. We're not caught with our proverbial pants down. We must be able to defeat this virus. We are at war. We are at war with an invincible enemy, and we must defeat this enemy. And the Western Cape is the epicenter, and this is where I would like to see positive and good results and immediately. And we want to be able to do that throughout the country. And as we move forward, I'm satisfied that the plans that are on the table should be able to enable us to do that. We've got our health specialists who have come here from various places in the country, as well as our Cuban friends who are also here. And I've said that we need to employ more health workers, bring them in, and the community screening must carry on. The testing must also be upgraded. And if we can employ and deploy all those tools, we should be able to see the level of infections in the Western Cape coming down. So I'd like to thank the Premier for also showcasing to us this wonderful initiative that MEC Madikizela has struck with the Taxi Association, that of being able to transport health workers in safety and in a measure of comfort from home to hospital, hospital to home. That is really a great initiative, which is also technologically driven. COVID-19 should be able to unleash a number of opportunities, a number of things that we can do in a different way, and we should utilize it. And as they say in the classics, never waste a crisis. Utilize a crisis to the greatest effect. And this is precisely what I'm pleased that we're beginning to do, and it's also being done in many parts of the country. So thank you very much. It's been a day well spent. And thank you so much.
Thank you, Mr. President. I'll take one round of questions. Take 3 hands. 1 with the mask, 2, 3. I'll come back for another round. You can go first, sir.
President, my name is Yazid Kamal and I'm from the West of Africa. So one of the ways that we can beat or flatten the curve of the infections of COVID-19 is isolation, self-isolation. Now we are on level 3, so people are moving around more freely, and most people are quite poor. They don't have a room even to themselves. So what will we do in the Western Cape with this situation when we are being called on to self-isolate? Most people can't even do that. Thank you.
Thank you, Aisha.
Mr. President, Aisha Ismail, ENCA. We have heard from the Western Cape Head of Health, Dr. Jean Porter. He confirmed that there has been an increase in the number of alcohol-related admissions in Western Cape hospitals, and these people now taking up bed space in our ICU units, and we heard of a shortage of beds. Will you consider reimposing the ban on convenient space?
The last question, yes, sir.
All right, Mr. President, Ulelani from SABC. My question relates to when are you going to have another family meeting for the country to actually determine whether are we still on track in terms of flattening the curve? Are we going to go down or are we going to go up?
Well, let's start with the family meeting. We will have another family meeting soon. My fellow South Africans, that will happen because we do need on a regular basis to be communicating exactly where we are going, and we've accumulated enough information now in the past few days since we started with level 3 as to be able to see pointers where we're going, and the visit here in the Western Cape adds to that. And the Deputy President is also in Mangaung and Bloemfontein. That also adds to that. So there will be a family meeting soon, and we'll be able to do an analysis where we're going, where we are. So let's wait for that. As regards alcohol, it was always going to be a difficult and a risky development to lift the ban on alcohol. Unfortunately, we as South Africans, our alcohol consumption is one of the highest in the world. And during the time of level 5 and 4, we saw alcohol consumption had gone down, and drunken driving accidents had almost come to a stop. There were none, and hospital beds had become empty of patients with trauma, And so as we opened, we suddenly saw a spike in the utilization of our hospital beds. It was always going to be a risk. And we're not contemplating closing for alcohol as yet. Obviously, we're hoping and calling on all South Africans to behave in a manner that will take into account the rights of other people to health and also to health care. And we hope that that message will sink in and South Africans will be able to, particularly now when we are at war, to behave themselves. When you are at war, many other activities of a pleasant nature usually come to a stop. And we would like to see that also happening around the utilization of alcohol, that people should drink responsibly and not put themselves in situations.
We're listening to President Cyril Ramaphosa speaking in Cape Town this afternoon, ending or concluding what he's described as a day well spent on a visit to the Western Cape. He's flanked this afternoon by Ministers Zweli Mhkize, the Minister for Health, as well as Transport Minister Fikile Mbalula. They did give a briefing earlier in the day, so what we're seeing is the conclusion of that visit. The President and the two ministers, as well as the Western Cape officials, exchanging some last-minute pleasantries, if you will. We will bring you much more on that story in the coming hours later here on